My mother chose my sister's wedding over my cancer surgery. 6 months later, she called asking me to be the maid of honor. I told her the only thing she deserved from me was the truth about what kind of mother abandons her daughter on the day she needs her most. What happened next changed everything about how I understood family, loyalty, and my own worth. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. My name is Rebecca Chen, and for 28 years, I believed that unconditional love meant accepting whatever scraps of attention my family was willing to offer. I convinced myself that being the afterthought daughter was simply my role in our family dynamic, something I needed to accept with grace and understanding. I told myself that my mother's obvious preference for my older sister Victoria was natural, even justified, because Victoria needed more support and guidance than I did. The pattern established itself early and never wavered throughout our childhood and into our adult lives. Victoria received elaborate birthday celebrations with themed parties, professional photography, and guest lists that filled our backyard. My birthdays were acknowledged with store-bought cake and immediate family members who seemed eager to conclude the obligatory celebration and return to more pressing matters. When Victoria expressed interest in piano lessons, my parents immediately researched instructors, purchased a quality instrument, and cleared their schedules to transport her to weekly sessions. When I mentioned wanting to try art classes, I received vague promises about looking into options when finances improved, promises that never materialized into actual enrollment or supplies. The educational support differential became even more pronounced as we progressed through school. Victoria received tutoring for subjects that challenged her, while I was expected to maintain my high grades through independent effort and natural ability. When Victoria struggled with mathematics, my parents hired a private tutor and spent considerable time helping her with homework assignments. When I excelled in science and expressed interest in advanced placement courses, I was told that such programs were unnecessary since I was already performing well without additional support. College preparation followed the same pattern of unequal investment and attention. Victoria received comprehensive support for her college applications, including professional assistance with essay writing, campus visits to multiple institutions, and extensive discussions about academic programs and career possibilities. My parents attended every college fair and information session that might benefit Victoria's applications, treating her educational future as a family priority that required coordinated effort and financial investment. When my turn arrived for college planning, the family resources and attention had somehow become limited. I was expected to navigate the application process independently, while my parents focused on Victoria's law school applications and the financial requirements of her continued education. The message was clear that my academic achievements were expected rather than celebrated, while Victoria's progress required ongoing family support and encouragement. The professional development years continued this established pattern of differential treatment and investment. When Victoria passed the bar examination and began her legal career, my parents organized a celebration dinner, invited extended family members, and spent considerable time discussing her professional accomplishments and future prospects. When I completed my nursing degree and secured a position at the regional medical center, the achievement was acknowledged with brief congratulations before the conversation returned to Victoria's legal cases and career advancement opportunities. Victoria's romantic relationships received extensive family attention and involvement, with my parents treating each boyfriend as a potential addition to our family who deserved welcome and evaluation. They invested time in getting to know Victoria's partners, included them in family gatherings, and offered opinions and advice about relationship decisions. My romantic relationships were acknowledged politely, but never received the same level of family interest or involvement. The engagement, announcement that would eventually lead to the most devastating betrayal of my life, occurred during a family dinner at my parents' house. Victoria and her fiancé, David Martinez, had been dating for 2 years, during which time my parents had embraced him as the son they never had, and the perfect match for their favored daughter. The engagement ring was displayed, photographs were taken, and immediate planning conversations began about wedding venues, guest lists, and celebration details. I participated in the excitement appropriately, offering congratulations and expressing happiness for Victoria's engagement, while internally noting the immediate shift in family focus and energy toward wedding planning activities. The engagement became the central topic of family conversations, with every gathering revolving around venue selections, dress appointments, catering decisions, and honeymoon destinations. My parents threw themselves into wedding planning with enthusiasm that exceeded anything I had witnessed in their approach to previous family events or celebrations. The wedding date was set for June 15th, a Saturday that would allow maximum attendance from extended family members and friends. The venue selection process involved visits to multiple locations, tastings at various catering establishments, and extensive discussions about guest accommodations and entertainment options. No expense or effort was considered too great for ensuring that Victoria's wedding would be the perfect celebration she deserved. During the months of wedding planning, I maintained my supportive role, while privately noting the disparity between the attention and resources devoted to Victoria's celebration and the level of family investment that had characterized my own major life events. I told myself that weddings were naturally more significant than individual accomplishments, that Victoria's happiness justified the extraordinary family focus, and that my feelings of being overlooked were selfish and inappropriate. The wedding. Planning consumed family conversations, weekend activities, and financial resources in ways that made clear this event represented the culmination of my parents' hopes and dreams for their favored daughter. I participated in dress shopping expeditions, offered opinions about floral arrangements, and contributed to discussions about reception entertainment while maintaining the supportive attitude that had characterized my role in family dynamics. Throughout my life, the medical appointment that would change everything occurred on a routine Tuesday morning in February, 4 months before Victoria's wedding date. I had scheduled the appointment to investigate persistent fatigue and unexplained weight loss that I had initially attributed to work stress and irregular eating patterns. As a registered nurse, I understood the importance of addressing health concerns promptly, but I had delayed seeking medical attention because of my tendency to minimize my own needs and avoid creating family worry or disruption. The mammogram and subsequent ultrasound revealed abnormalities that required immediate biopsy and further testing. The radiologist's expression and the sudden change in appointment scheduling indicated that my concerns were not unfounded and that serious medical investigation was necessary. I left the medical office with follow-up appointments scheduled and the beginning awareness that my life might be about to change in ways that would test every assumption I had about family support and priorities. The biopsy results confirmed what the imaging studies had suggested. I had breast cancer, specifically invasive ductal carcinoma that required aggressive treatment, including surgery, chemotherapy, and radiation therapy. The oncologist explained that my prognosis was positive given early detection, but that treatment would be comprehensive and would require significant lifestyle adjustments and family support during the months ahead. The treatment timeline presented an immediate conflict with Victoria's wedding plans. The surgical date recommended by my medical team fell on June 10th, 5 days before Victoria's wedding celebration. The surgery could not be delayed without potentially compromising my treatment outcomes and long-term prognosis. The timing created a situation that would force my family to choose between supporting my medical treatment and participating in Victoria's wedding activities. I approached this conflict with the same accommodating attitude that had characterized my family relationships throughout my life. I assumed that my parents would naturally prioritize my medical needs and that Victoria would understand the importance of family support during my treatment. I believed that our family bonds were strong enough to withstand this scheduling conflict, and that creative solutions could be found that would address both my medical needs and Victoria's celebration requirements. The conversation with my parents about my diagnosis and treatment timeline revealed assumptions about family priorities that I had never previously questioned. I explained my medical situation, described the treatment requirements, and outlined the surgical scheduling that created the timing conflict with Victoria's wedding. I expected immediate family rallying around my medical needs and automatic adjustment of wedding plans to accommodate my treatment requirements. Instead, I encountered resistance, questions about alternative scheduling, and suggestions that my medical team could surely accommodate different timing that would not interfere with Victoria's celebration. My parents seemed more concerned about the potential disruption to wedding plans than about my cancer diagnosis and treatment needs. The conversation revealed family priorities that differed dramatically from what I had expected and assumed about our relationships. The weeks following my diagnosis became a period of devastating revelation about my family's actual priorities and the extent to which Victoria's needs consistently superseded my own in their consideration and planning. Rather than receiving the support and attention that seemed appropriate for a serious medical diagnosis, I found myself defending my treatment timeline and advocating for my own medical needs in ways that felt foreign and uncomfortable. This period of family conflict and medical uncertainty would ultimately become the catalyst for the most significant personal transformation of my life, forcing me to confront long-held assumptions about family loyalty, self-advocacy, and the difference between unconditional love and unconditional accommodation. The events that followed would test every belief I had about family relationships, while providing opportunities for growth and self-discovery that would change my understanding of my own worth and potential. The medical diagnosis that threatened my life would ultimately save my emotional and psychological well-being by forcing recognition of family dynamics that had limited my potential and undermined my self-confidence for nearly 3 decades. The crisis that began with abnormal test results would become the foundation for rebuilding my life according to principles of self-respect, authentic relationships, and personal empowerment that had been absent from my previous experience. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. The journey from diagnosis to recovery would encompass not only physical healing from cancer treatment, but emotional healing from family relationships that had consistently undervalued my needs and contributions. The medical crisis would provide both the motivation and the opportunity to establish new patterns of self-advocacy and relationship management that would serve as the foundation for a more fulfilling and authentic life. The revelation of my family's true priorities when faced with competing demands would become the catalyst for personal growth that exceeded anything I had achieved through previous challenges or opportunities. The medical emergency would ultimately provide the clarity and motivation necessary to transform not only my health outcomes, but my entire approach to relationships, self-worth, and life priorities. The cancer diagnosis that initially appeared to threaten everything I valued would become the beginning of discovering what truly mattered in life and relationships. The medical crisis would strip away illusions about family dynamics while providing opportunities to build genuine connections based on mutual respect and authentic care, rather than obligation and accommodation. The treatment journey that began with terrifying uncertainty would become a path toward self-discovery and empowerment that exceeded anything I had previously imagined possible. The medical challenge would provide both the necessity and the courage to establish boundaries, advocate for my needs, and build relationships that honored my worth and contributed to my well-being, rather than diminishing my sense of self and potential. This first phase of my journey established the foundation for everything that would follow, revealing both the limitations of my previous family relationships and the possibilities for creating something better. The medical diagnosis would become not just a health challenge to overcome, but a catalyst for comprehensive life transformation that would affect every aspect of my future relationships and decisions. The conversation that would shatter my understanding of maternal love occurred on a Thursday evening in March, 6 weeks after my cancer diagnosis and 3 months before Victoria's wedding. I had requested a family meeting to discuss the practical arrangements needed for my surgery and recovery period, assuming that my parents would naturally adjust their schedules and priorities to provide the support that seemed essential for my medical treatment. I arrived at my parents' house carrying a folder of medical documents, treatment schedules, and recovery timelines that my oncologist had provided. The surgical date of June 10th was non-negotiable, according to my medical team, who emphasized that any delay could compromise my treatment outcomes and potentially affect my long-term prognosis. I had prepared detailed explanations about why the timing was medically necessary and had researched recovery requirements to help my family understand what support I would need. My mother, Patricia Chen, greeted me with the distracted politeness that had characterized her interactions with me since Victoria's engagement announcement. My father, Robert Chen, was reviewing wedding vendor contracts at the kitchen table, surrounded by catering proposals and floral arrangement catalogs that represented months of intensive planning and significant financial investment. The visual representation of their priorities was immediately apparent in the way wedding materials dominated the family space, while my medical situation seemed to merit only scheduled discussion time. Victoria arrived 20 minutes late, apologizing about traffic while carrying sample wedding favors that required immediate family input about color coordination and presentation options. Her presence shifted the family energy in ways that I recognized from decades of similar experiences, with my parents becoming more animated and engaged when their favored daughter entered the room. The contrast between their enthusiasm for Victoria's concerns and their dutiful attention to my medical situation established the emotional context for everything that followed. I began the conversation by reviewing my diagnosis and treatment plan, emphasizing the medical necessity of the surgical timing, and explaining the recovery support that would be required during the weeks following my procedure. I presented the information systematically, using my professional medical knowledge to ensure that my family understood the seriousness of my condition and the importance of adherence to the treatment schedule recommended by my oncology team. The response was not what I had anticipated or needed during this critical period of my life. Instead of immediate family mobilization around my medical needs, I encountered a series of questions about whether alternative scheduling might be possible, suggestions that second opinions might yield more flexible timing options, and concerns about how my treatment timeline would affect Victoria's wedding plans and the family's ability to fulfill their commitments to her celebration. My mother's first substantive comment addressed logistics rather than my medical condition. She explained that June 10th fell during the most intensive week of wedding preparation, when final venue arrangements needed to be confirmed, out-of-town relatives would be arriving for the celebration, and countless last-minute details required family attention and coordination. She emphasized that my surgical timing would create enormous stress and distraction during what should be the most joyful week of Victoria's life. My father focused on financial considerations, noting that significant deposits had been made for wedding vendors, travel arrangements had been finalized for extended family members, and the celebration represented the largest financial investment our family had ever undertaken. He questioned whether my medical team could accommodate different timing that would not interfere with the wedding schedule, suggesting that other patients might have more flexibility in their treatment timelines. Victoria's response revealed the extent to which wedding planning had consumed her perspective and priorities. She expressed sympathy for my medical situation, but immediately shifted focus to the impact that my surgery would have on her celebration, noting that family members would be distracted and emotionally unavailable during what was supposed to be the happiest time of her life. She questioned whether I had adequately explored all treatment options and whether my medical team was being unnecessarily rigid about scheduling requirements. The conversation continued for over 2 hours, during which time I found myself defending my medical needs rather than receiving the support and understanding that seemed appropriate for a serious cancer diagnosis. My family's primary concern appeared to be minimizing disruption to Victoria's wedding rather than ensuring optimal outcomes. For my treatment and recovery, The questions and suggestions focused on accommodation of wedding plans rather than logistics for my medical care. I attempted to explain that cancer treatment timing was determined by medical necessity rather than personal convenience, that my oncologist had emphasized the importance of proceeding without delay, and that my prognosis depended on following the recommended treatment schedule. These explanations were met with additional questions about second opinions, alternative treatment facilities, and whether other medical professionals might offer more flexible scheduling options. The turning point in the conversation occurred when my mother made a statement that revealed her fundamental priorities and permanently altered my understanding of our relationship. She acknowledged that my medical situation was concerning, but emphasized that Victoria's wedding was a once-in-a-lifetime celebration that had required months of planning and significant financial investment. She suggested that my surgery could potentially be rescheduled to accommodate the wedding timeline, noting that healthcare systems were accustomed to working around important family events. When I explained that medical emergencies could not be scheduled around social events, that cancer treatment required immediate attention, and that my life was potentially at stake, my mother's response demonstrated priorities that I had never fully recognized despite years of differential treatment. She stated that the wedding was Victoria's special day, that the family had obligations to ensure her celebration was perfect, and that my medical team would surely understand the importance of family commitments. The conversation reached its devastating conclusion when my mother explicitly articulated the choice she was making between my medical needs and Victoria's wedding celebration. She explained that she would be unable to provide support during my surgery and recovery because her presence was required for wedding preparations and the celebration itself. She noted that Victoria needed her mother during this important time, that wedding vendors required family coordination, and that months of planning could not be abandoned because of my medical timing. My father supported this decision by emphasizing the financial implications of disrupting wedding plans, noting that vendors would not refund deposits, that guest accommodations could not be canceled without penalty, and that the family's reputation would be damaged if they failed to fulfill their commitments to Victoria's celebration. He suggested that I could arrange alternative support systems for my surgery and recovery, perhaps through friends or professional services that would not interfere with the family's wedding obligations. Victoria's response completed the family consensus by expressing appreciation for their support, while acknowledging that my medical situation was unfortunate timing that should not be allowed to overshadow her special day. She suggested that I would understand their position once I considered the months of planning and preparation that had gone into her wedding, noting that healthcare emergencies occurred frequently, while marriages happened only once. The emotional impact of this conversation exceeded anything I had experienced in my lifetime of being the secondary priority in family considerations. The explicit choice between my potential life-threatening medical emergency and Victoria's social celebration revealed family dynamics that I had never fully acknowledged despite years of differential treatment. The casual dismissal of my medical needs in favor of wedding logistics demonstrated priorities that were both devastating and clarifying. I left my parents' house that evening with the understanding that I would face my cancer surgery and recovery without family support, that my medical emergency was considered less important than Victoria's wedding celebration, and that my role in family dynamics was to accommodate others' needs, regardless of the impact on my own well-being. The conversation had revealed truths about family relationships that were painful, but necessary for understanding my actual position in their priorities and affections. The weeks following this conversation became a period of intense emotional processing and practical preparation for surgery without family support. I arranged for time off from work, identified friends who could provide transportation and assistance during recovery, and developed support systems that did not depend on family members who had made clear their unavailability during my medical crisis. The professional relationships I had developed through my nursing career became crucial resources during this period. Colleagues who understood medical realities offered practical assistance and emotional support that my family had declined to provide. The contrast between professional colleagues who prioritized my health needs and family members who prioritized social celebrations became a source of both comfort and additional pain. I also began recognizing patterns in my family relationships that had previously seemed normal, but now appeared problematic when viewed through the lens of this medical crisis. The lifetime of accommodating others' needs while minimizing my own had created dynamics that made my family's choice seem reasonable to them, while devastating to me. The revelation forced acknowledgement of relationship patterns that had undermined my self-worth and limited my expectations of support and consideration. The practical arrangements for surgery without family support required developing independence and self-advocacy skills that I had never needed to cultivate. I researched recovery requirements, arranged for professional assistance when necessary, and created backup plans for potential complications that might arise during my treatment period. The process of preparing for major medical treatment without family support was both empowering and frightening. The emotional preparation involved accepting that my family's priorities differed fundamentally from what I had believed about our relationships. The explicit choice between my medical emergency and Victoria's wedding had removed any ambiguity about their values and loyalties. The clarity was painful, but also liberating in ways that I had not anticipated when requesting their support. The period leading up to my surgery became a time of unexpected personal growth and self-discovery. The necessity of creating independent support systems revealed capabilities and resources that I had not previously developed or recognized. The absence of family support forced me to identify and nurture relationships that were based on mutual care rather than obligation and accommodation. The contrast between my family's response to my medical crisis and the support I received from friends and colleagues provided valuable perspective on relationship quality and authenticity. The people who prioritized my health and well-being, despite having no family obligation to do so, demonstrated what genuine care and support looked like when compared to the conditional and limited support offered by family members. The medical crisis that had initially seemed to threaten everything I valued was becoming a catalyst for recognizing relationships and support systems that I had undervalued, while overinvesting in family dynamics that consistently disappointed and undermined me. The forced independence was revealing strengths and resources that had been obscured by my focus on gaining family approval and accommodation. The approaching surgery date represented not only a medical intervention necessary for my physical survival, but also a symbolic transition point in my understanding of relationships, self-worth, and life priorities. The family's explicit choice of wedding celebrations over medical emergencies had created an opportunity for fundamental reassessment of values and relationship investments that would shape every aspect of my future life. The devastating conversation that revealed my family's true priorities had paradoxically provided the clarity and motivation necessary to begin building a life based on authentic relationships and self-respect rather than accommodation and secondary status. The medical crisis that had exposed the limitations of family support was simultaneously creating opportunities for discovering more reliable and meaningful connections with people who valued my well-being and recognized my worth. The weeks following, my family's devastating decision became a period of profound personal awakening and the development of independence that I had never been required to cultivate. The necessity of facing major surgery without family support forced me to examine every assumption I had maintained about relationships, self-sufficiency, and the sources of genuine strength and resilience during life's most challenging moments. My first priority involved establishing practical support systems that could provide the assistance I would need during surgery and the subsequent recovery period. This requirement led me to reach out to colleagues, friends, and acquaintances in ways that revealed the depth of genuine concern and care that existed in relationships I had previously undervalued, while focusing my emotional energy on gaining family approval and accommodation. Dr. Sarah Mitchell, the head nurse in the oncology department where I worked, became my primary advocate and coordinator during this period. When I explained my family situation with professional composure that barely masked my emotional devastation, Dr. Mitchell responded with immediate practical assistance and unwavering emotional support that demonstrated what authentic care looked like when compared to my family's conditional and limited concern. Dr. Mitchell organized a comprehensive support network among my nursing colleagues that addressed every aspect of my surgical and recovery needs. The response from my professional community revealed relationships that I had not fully appreciated while investing my emotional energy in family dynamics that consistently disappointed and undermined my well-being. The contrast between professional colleagues who prioritized my health needs and family members who prioritized social celebrations became a source of both comfort and profound realization about relationship quality and authenticity. My colleague, Jennifer Walsh, volunteered to serve as my primary emergency contact and medical advocate during surgery, a role that traditionally would have been filled by immediate family members. Jennifer's commitment to providing this essential support, despite having no family obligation to do so, demonstrated the difference between relationships based on genuine care and those maintained through duty and accommodation. The practical arrangements extended beyond immediate surgical support to encompass the entire recovery period that would follow my procedure. My colleague Maria Rodriguez offered to coordinate meal preparation and delivery during the weeks when I would be unable to manage normal daily activities. The nursing staff organized a rotation schedule that ensured I would have regular check-ins and assistance with household tasks that might be challenging during my recovery period. These arrangements revealed capabilities within my professional and social network that I had never needed to access, because I had always assumed that family support would be available during medical emergencies. The forced independence created opportunities to discover the reliability and depth of relationships that had been overshadowed by my focus on gaining family acceptance and approval. The emotional support provided by my colleagues exceeded anything I had received from my family. During previous challenges and difficulties, the genuine concern for my well-being, the proactive assistance with practical needs, and the consistent availability for emotional processing created a support system that was both more reliable and more nurturing than anything I had experienced within family relationships. Dr. Mitchell also connected me with other cancer patients who had navigated treatment without traditional family support, creating opportunities to learn from others who had faced similar challenges and developed effective coping strategies. These connections revealed that my situation, while painful, was not unique and that many people had successfully managed serious medical treatment while building alternative support systems that proved more reliable than expected family assistance. The cancer support group that Dr. Mitchell recommended became an unexpected source of insight and inspiration during this difficult period. The other group members included individuals from diverse backgrounds who had faced various challenges related to family dynamics during medical treatment. Their stories provided perspective on relationship patterns and family dysfunction, while demonstrating that healing and recovery were possible even when traditional support systems proved inadequate or unavailable. One group member, Linda Thompson, had faced breast cancer treatment 5 years earlier, when her adult children were more concerned about inheritance implications than her medical needs. Linda's experience taught me that family dysfunction during medical crises often revealed long-standing relationship patterns that became apparent only when serious challenges required genuine sacrifice and support from others. Another group member, Patricia Williams, had navigated cancer treatment while caring for elderly parents who required ongoing assistance and could not provide the support she needed during her own medical emergency. Patricia's story demonstrated that independence and self-advocacy were not selfish choices, but necessary skills for managing life challenges when traditional support systems were unavailable or inadequate. The support group discussions revealed that many participants had discovered unexpected sources of strength and resilience during their medical treatment that extended far beyond their initial cancer diagnosis and treatment. The necessity of developing independence and alternative support systems often led to personal growth and relationship improvements that enhanced their lives in ways that exceeded their pre-diagnosis circumstances. These conversations helped me recognize that my family's response to my medical crisis, while devastating and disappointing, was also providing opportunities for personal development and relationship building that would not have been necessary if they had provided the expected support. The forced independence was revealing capabilities and resources that had been dormant while I focused on accommodating family dynamics that limited my growth and self-confidence. The period of preparation for surgery without family support also led to important conversations with friends who had observed my family relationships from outside perspectives. These friends provided insights about patterns they had noticed but had not felt comfortable addressing, while I maintained loyal and accommodating attitudes toward family members who consistently undervalued my contributions and needs. My friend and former roommate from nursing school, Amanda Foster, visited during this period and provided perspective that was both painful and liberating. Amanda had witnessed my family dynamics during our college years and had observed the differential treatment that I had normalized and accepted as appropriate family functioning. Her outside perspective helped me recognize that my family's behavior was not normal or acceptable, and that my expectations of support and consideration were reasonable rather than excessive. Amanda's observations about my tendency to minimize my own needs while maximizing accommodation for others provided insight into relationship patterns that had developed during childhood and continued into my adult relationships. She helped me understand that my family's response to my medical crisis was consistent with long-standing dynamics rather than an isolated incident of poor judgment or timing. These conversations with Amanda and other friends revealed that people outside my family had recognized problematic patterns in our relationships long before I had been willing to acknowledge them. The medical crisis had created circumstances that made these patterns impossible to ignore or rationalize, forcing recognition of relationship dynamics that had undermined my self-worth and limited my potential for decades. The process of preparing for surgery independently also required developing communication skills and self-advocacy capabilities that I had never needed to cultivate within family relationships, where accommodation and flexibility had been my primary contributions. Learning to articulate my needs clearly, establish boundaries around my energy and time, and prioritize my own well-being represented fundamental shifts in how I approached relationships and personal management. The pre-surgical period included extensive medical appointments, tests, and consultations that required coordination and emotional processing that would have traditionally involved family members. Managing these appointments independently while working full-time and preparing for extended medical leave required organizational skills and emotional resilience that exceeded anything I had previously developed or recognized in myself. The medical team's response to my situation provided additional perspective on family dynamics and support systems. My oncologist, Dr. Rachel Torres, had extensive experience with patients facing family challenges during cancer treatment and was able to provide guidance about managing medical decisions independently while maintaining focus on optimal health outcomes. Dr. Torres explained that family dysfunction during medical crises was unfortunately common, and that patients who developed independent decision-making capabilities often achieved better treatment outcomes because they were able to prioritize medical needs without family interference or pressure to accommodate others' schedules and preferences. This professional perspective helped normalize my situation while providing encouragement about my ability to manage treatment successfully without traditional family support. The surgical preparation process also included practical considerations, such as arranging time off from work, preparing my home for recovery needs, and ensuring that financial arrangements were in place for potential extended medical leave. Managing these logistics independently required research and planning skills that revealed capabilities I had not previously recognized or developed. The financial planning aspect of my medical treatment highlighted another area where independence provided advantages over family involvement. Without needing to consider family opinions or coordinate with others' financial priorities, I was able to make decisions based solely on my medical needs and personal financial situation. This autonomy allowed for optimal treatment choices without compromise or delay related to family financial concerns or competing priorities. The emotional preparation for surgery without family support involved developing coping strategies and mental frameworks that could sustain me through the challenging treatment period ahead. This psychological preparation required acknowledging the reality of my family relationships while maintaining hope and determination about my medical treatment and recovery prospects. The process of building alternative support systems and developing independence had already begun transforming my understanding of my own capabilities and worth. The necessity of self-advocacy and independent planning was revealing strengths that had been obscured by decades of accommodation and secondary status within family dynamics. The medical crisis that had initially seemed to threaten everything I valued was simultaneously creating opportunities for personal growth and self-discovery that exceeded anything I had achieved through previous challenges or circumstances. The approaching surgery date represented not only a medical intervention necessary for my physical survival, but also a symbolic transition point in my journey toward independence and authentic relationships based on mutual respect and genuine care rather than obligation and accommodation. The final weeks before my surgery became a study in family dysfunction that revealed depths of selfishness and emotional neglect that I had never fully comprehended despite decades of differential treatment. While Victoria's wedding preparations reached fever pitch with daily phone calls, vendor meetings, and shopping expeditions that consumed my parents' attention and energy, my impending cancer surgery was treated as an inconvenient disruption that warranted minimal acknowledgement or concern. The contrast between my family's response to Victoria's celebration and their reaction to my medical emergency became starkly apparent through their communication patterns during this critical period. Victoria received multiple daily phone calls, from my mother discussing wedding details, vendor confirmations, and last-minute arrangements that required immediate family coordination. Meanwhile, my cancer surgery scheduled for the same week merited occasional brief inquiries about whether I had arranged adequate support and transportation, delivered with the tone of checking off obligatory responsibilities rather than expressing genuine concern for my well-being. My mother's involvement in Victoria's wedding preparations during this period demonstrated energy and attention that exceeded anything she had ever invested in my life events or challenges. She accompanied Victoria to multiple dress fittings, coordinated with wedding vendors on a daily basis, managed guest accommodations for out-of-town relatives, and devoted countless hours to ensuring that every detail of the celebration would meet Victoria's exacting standards and create the perfect day she deserved. The wedding planning activities consumed family conversations, weekend activities, and financial resources in ways that made my medical situation seem invisible by comparison. When I attempted to discuss my surgery or recovery needs during family phone calls, the conversations invariably shifted back to wedding logistics within minutes, with my mother explaining that immediate decisions were required about floral arrangements, seating charts, or catering adjustments that could not be delayed. My father's involvement in wedding preparations revealed similar patterns of prioritization that demonstrated where family attention and resources were directed during this period. He spent considerable time researching photographers, comparing catering options, and coordinating transportation arrangements for wedding guests while showing minimal interest in my medical appointments, treatment plans, or recovery requirements. The financial investment in Victoria's wedding continued to escalate during this period, with additional expenses for upgraded venues, enhanced catering packages, and professional services that reflected my parents' commitment to ensuring that no expense would be spared for their favored daughter's celebration. The contrast between this lavish spending on social celebration and their absence of financial support or assistance for my medical expenses created additional pain during an already difficult period. Victoria's behavior during these final weeks before surgery demonstrated self-absorption that exceeded anything I had previously witnessed in our family dynamics. Her daily communications with my parents focused exclusively on wedding preparations, with no inquiries about my medical condition, treatment concerns, or emotional well-being as I approached major surgery for a life-threatening illness. The wedding preparations that dominated Victoria's attention included elaborate planning for the rehearsal dinner, bachelor and bachelorette parties, and post-wedding brunch that extended the celebration across multiple days and required extensive family coordination. These activities were scheduled for the exact period when I would be undergoing surgery and beginning my recovery, with no apparent recognition or concern about the timing conflict or my need for family support. Victoria's social media presence during this period provided painful evidence of her complete focus on celebration while her sister faced cancer surgery. Her daily posts featured wedding preparation activities, dress shopping expeditions, and vendor meetings that documented her excitement and anticipation for the upcoming celebration. The absence of any acknowledgement of my medical situation in her public communications reflected the same indifference that characterized her private interactions with me during this period. The extended family members who had been invited to Victoria's wedding and were coordinating travel arrangements demonstrated more concern for my medical situation than my immediate family members. Aunts, uncles, and cousins who learned about my cancer diagnosis through indirect communications expressed shock that my surgery was scheduled during wedding week and offered to provide support or assistance if needed during my recovery period. These extended family responses revealed that my parents had not communicated the seriousness of my medical situation to relatives who would normally be informed about significant health challenges affecting family members. The selective information sharing suggested that my cancer diagnosis was being minimized or concealed to prevent any disruption to wedding planning activities or guest participation in the celebration. My grandmother, Margaret Chen, who lived in assisted living facility 3 hours away, provided the most devastating perspective on my family's priorities during this period. When she learned about my cancer diagnosis through a phone call from my aunt, rather than direct communication from my parents, she was appalled by their failure to prioritize my medical needs and immediately offered to travel to provide support during my surgery and recovery. My grandmother's response highlighted the abnormal nature of my family's behavior by contrasting their indifference with the concern that would be expected from loving family members facing a medical emergency. Her offer to provide support, despite her own health limitations and transportation challenges, demonstrated what genuine family loyalty looked like when compared to my parents' wedding-focused priorities. The conversation with my grandmother also revealed that my parents had misrepresented my medical situation to extended family members, describing my cancer as a minor health issue that required routine treatment rather than acknowledging the seriousness of my diagnosis and the importance of family support during this challenging period. This deliberate minimization served to protect Victoria's wedding celebration from any potential disruption or family concern that might affect guest attendance or celebration enthusiasm. My workplace colleagues continued to provide the support, and understanding that my family had declined to offer during this critical period, the nursing staff organized coverage for my patient assignments during my medical leave, arranged for meal delivery during my recovery period, and maintained regular communication about my progress and needs throughout the treatment process. The professional environment where I worked demonstrated what genuine care and support looked like when people prioritized health and well-being over social obligations and convenience. The contrast between my colleagues' proactive assistance and my family's passive indifference provided clear evidence of relationship quality and authentic concern for my welfare. Dr. Mitchell arranged for me to have private consultations with the hospital social worker who specialized in family dynamics during medical treatment. These sessions provided professional perspective on my family's behavior and helped me understand that their response was both abnormal and harmful to my emotional well-being during an already stressful medical situation. The social worker, Maria Santos, explained that family dysfunction during medical crises often revealed long-standing relationship patterns that became pronounced when serious challenges required genuine sacrifice and emotional investment from family members. She helped me recognize that my family's behavior was not a reflection of my worth or the seriousness of my medical condition, but rather an indication of their inability to provide appropriate support and priority management during crisis situations. These professional consultations also provided guidance about managing my emotional responses to family dysfunction while maintaining focus on my medical treatment and recovery goals. The counseling sessions helped me develop coping strategies that would sustain me through surgery and the recovery period while protecting my emotional well-being from further family-related disappointment and neglect. The final week before my surgery became a period of intense preparation that highlighted the complete absence of family involvement in what should have been a shared experience of concern and support. While Victoria's wedding week activities dominated my parents' schedules and attention, I managed pre-surgical appointments, completed medical paperwork, and prepared my home for recovery without any family assistance or involvement. The medical appointments during this final week included consultations with my surgical team, anesthesiology staff, and post-operative care coordinators who would be responsible for my treatment and recovery. These appointments would traditionally involve family members who could provide emotional support and help process medical information, but I attended them alone while my parents focused on wedding preparation activities. The pre-surgical testing and preparation procedures required several hospital visits for blood work, imaging studies, and medical evaluations that confirmed my readiness for the surgical procedure. The hospital staff commented on my apparent lack of family support during these appointments, noting that most cancer patients had relatives present for emotional support and assistance with medical information management. The evening before my surgery, I spent time alone in my apartment, completing final preparations, and reflecting on the journey that had brought me to this point of medical treatment without family support. The solitude provided opportunities for emotional processing and mental preparation that might not have been possible with family members present, who prioritized other concerns over my medical needs. The absence of family contact during this final evening before surgery was both painful and liberating. While I grieved the lack of supportive phone calls or visits that would have been expected from loving family members, I also appreciated the freedom from family drama and competing priorities that allowed me to focus entirely on my own emotional and psychological preparation for the challenging treatment ahead. The practical arrangements for surgery day had been coordinated entirely through my alternative support system of colleagues and friends who demonstrated reliability and commitment that exceeded anything my family had provided during previous challenges or difficulties. The comparison between professional colleagues who prioritized my health needs and family members who prioritized social celebrations had become impossible to ignore or rationalize. As I prepared for sleep on the evening before my cancer surgery, I recognized that the medical crisis had already begun transforming my understanding of relationships, self-worth, and the sources of genuine strength and resilience during life's most challenging moments. The family dysfunction that had initially seemed devastating was simultaneously creating opportunities for personal growth and authentic relationship building that would enhance my life in ways that extended far beyond my medical treatment and recovery. The morning of June 10th arrived with the clarity and determination that emerges when an individual has exhausted all hope for external validation and must rely entirely on internal strength and carefully constructed support systems. I awakened at 5:30 in the morning, 3 hours before my scheduled arrival at the hospital, with the profound understanding that this day would mark not only a critical intervention in my cancer treatment, but also a definitive demonstration of my capacity to navigate life's most challenging circumstances without the family support that had never been reliable or consistent. The pre-surgical routine I had established during the preceding weeks reflected the systematic approach to independence that had become necessary when traditional support systems proved inadequate. I completed my morning preparations with methodical precision, reviewing the checklist of required items, confirming transportation arrangements with Jennifer Walsh, and conducting final verification of post-surgical care coordination that would ensure seamless transition from hospital to home. Recovery. Jennifer arrived at my apartment at precisely 7:15, 30 minutes before our planned departure time, carrying a bag of comfort items and encouraging reading materials that demonstrated thoughtfulness and consideration that exceeded anything my family had provided during previous medical situations. Her punctuality and preparation reflected the reliability that had characterized every aspect of the alternative support system I had developed during the weeks of family abandonment. The drive to the hospital provided opportunities for final emotional preparation and conversation with someone who understood both the medical significance of my surgery and the emotional complexity of facing this challenge without family support. Jennifer's presence offered genuine comfort and encouragement that was free from the competing priorities and conditional support that had characterized my family relationships throughout my lifetime. The hospital arrival and registration process proceeded smoothly due to the advanced preparation and coordination that I had managed independently during the preceding weeks. The admissions staff commented positively on the thoroughness of my paperwork and the clarity of my emergency contact information, noting that many patients required assistance with documentation that I had completed systematically and accurately. The pre-surgical preparation area became a space where the absence of family members was both noticeable and, surprisingly, liberating. While other patients were surrounded by anxious relatives who required emotional management and reassurance, I was able to focus entirely on my own psychological preparation and communication with medical staff without the distraction of managing others' emotional needs or concerns. Dr. Torres arrived for the final pre-surgical consultation with evident confidence in both my medical readiness and my psychological preparation for the procedure and recovery period. She commended my proactive approach to treatment planning and noted that patients who took active responsibility for their medical care often achieved superior outcomes compared to those who relied heavily on family members for decision-making and emotional support. The anesthesiology team conducted their pre-surgical evaluation with professional efficiency that reflected the high standards of medical care available at our regional medical center. The anesthesiologist, Dr. Michael Chen, explained the surgical procedure and recovery timeline with clarity that addressed my questions and concerns while maintaining appropriate optimism about expected outcomes and recovery prospects. The nursing staff assigned to my surgical preparation demonstrated the same professional competence and genuine care that I experienced daily in my own work environment. Their treatment of me as both patient and colleague created a comfortable atmosphere that reduced pre-surgical anxiety while maintaining appropriate medical protocols and safety standards. Jennifer remained present throughout the pre-surgical preparation process, providing emotional support and advocacy that would traditionally be provided by immediate family members. Her medical background enabled her to ask appropriate questions and understand medical explanations in ways that enhanced communication with the surgical team, while ensuring that my concerns and preferences were clearly communicated and understood. The final moments before surgical anesthesia provided opportunities for reflection on the journey that had brought me to this point of medical treatment without family support. The physical and emotional preparation that had been required to reach this moment had revealed personal strengths and resilience that had been dormant during decades of accommodation and secondary status within family dynamics. The surgical procedure itself proceeded according to the planned timeline and medical protocols that had been established during weeks of preoperative consultation and preparation. The medical team's expertise and coordination reflected the high standard of care that justified my confidence in their ability to achieve optimal surgical outcomes and support successful recovery. The post-anesthesia recovery period occurred under careful medical supervision that ensured appropriate monitoring of vital signs, pain management, and initial assessment of surgical outcomes. The nursing staff provided professional care that was both medically competent and emotionally supportive during the vulnerable period of emergence from anesthesia and initial recovery awareness. Jennifer remained present throughout the recovery period, providing continuous emotional support and communication with medical staff that ensured seamless coordination of care and information sharing. Her advocacy during this period demonstrated dedication and reliability that surpassed anything I had experienced from family members during previous medical situations or challenges. The initial post-surgical communication from Dr. Torres confirmed successful completion of the lumpectomy procedure with clear margins that indicated effective removal of cancerous tissue without the need for additional surgical intervention. The pathology results would require several days for complete analysis, but initial visual inspection suggested favorable outcomes that supported the treatment plan and recovery timeline. The pain management protocols established by the medical team provided effective relief while maintaining cognitive clarity that allowed for appropriate participation in post-surgical care decisions and communication with support personnel. The balance between comfort and awareness reflected medical expertise that prioritized both immediate patient needs and long-term recovery optimization. The hospital room assignment for my overnight observation period provided private accommodations that facilitated rest and recovery while allowing for visits from the support network that had been established during the weeks of preparation. The room's comfortable environment and medical monitoring capabilities reflected the quality of care available at our regional medical center. Jennifer coordinated communication with my workplace colleagues who had requested updates about surgical outcomes and recovery progress. The messages of support and encouragement from my professional community provided emotional reinforcement that demonstrated genuine concern for my well-being and successful recovery. Dr. Mitchell visited during the evening hours following surgery, bringing updates from our nursing department and expressing satisfaction with my surgical progress and post-operative recovery indicators. Her presence reinforced the professional relationships that had become primary sources of emotional support and practical assistance during this challenging period. The evening meal service and medication administration proceeded according to hospital protocols that ensured appropriate nutrition and pain management during the initial recovery phase. The nursing staff demonstrated competence and caring that reflected the professional standards I had experienced throughout my treatment process. The overnight recovery period provided opportunities for rest and reflection on the day's events, and the successful completion of the most critical phase of my cancer treatment. The absence of family visits or communication, while initially painful, had become liberating in ways that allowed for focus on healing and recovery without the emotional complications that family drama might have introduced. The morning discharge preparation involved final medical evaluations and review of home care instructions that would guide my recovery process during the weeks ahead. Dr. Torres expressed satisfaction with my surgical outcomes and confidence in my ability to manage post-operative care requirements with the support systems I had established. Jennifer coordinated transportation arrangements and home preparation activities that ensured seamless transition from hospital to home environment. Her attention to practical details and anticipation of recovery needs demonstrated thoughtfulness and reliability that had characterized every aspect of our collaboration during this challenging period. The discharge process included prescription management, follow-up appointment scheduling, and review of warning signs that would require immediate medical attention during the recovery period. The medical team's thoroughness in discharge planning reflected their commitment to supporting successful recovery outcomes through comprehensive patient education and support. The return to my apartment marked the beginning of the home recovery phase that would extend for several weeks and require continued reliance on the alternative support systems that had proven more reliable than family relationships. The practical arrangements for meal delivery, housekeeping assistance, and transportation to follow-up appointments had been coordinated through professional and personal relationships that prioritized my health and recovery. The first evening at home following surgery provided opportunities to process the emotional and psychological significance of having successfully navigated major medical treatment without family support. The experience had demonstrated personal resilience and the reliability of relationships based on genuine care rather than obligation and accommodation. The success of my surgical experience without family involvement had provided valuable perspective on relationship quality and the sources of authentic support during life's most challenging circumstances. The medical crisis that had initially seemed to threaten everything I valued had become a catalyst for discovering strength and resources that exceeded anything I had previously recognized or developed. The recovery period ahead would continue to test my independence and self-advocacy skills while providing opportunities for continued personal growth and relationship building based on mutual respect and genuine concern for well-being, rather than conditional support and competing priorities. The 3 days following my surgery coincided precisely with Victoria's wedding weekend, creating a stark juxtaposition between my quiet recovery at home and the elaborate celebration that had consumed my family's attention and resources for the preceding months. The timing provided an unexpected opportunity to observe my family's priorities from a position of complete detachment, offering clarity about relationship dynamics that had previously been obscured by my emotional investment in gaining their approval and acceptance. The Friday evening following my Thursday surgery marked the beginning of Victoria's wedding festivities with the rehearsal dinner that my parents had planned as an intimate gathering for immediate family members and the wedding party. The event represented months of careful coordination and significant financial investment, demonstrating the level of attention and resources that my family was capable of dedicating to celebrations that aligned with their priorities and values. My recovery process during this same evening involved managing post-surgical pain, monitoring incision sites for signs of complications, and coordinating with my support network to ensure appropriate care and assistance during the initial healing phase. The practical requirements of cancer recovery provided a sobering contrast to the social celebration occurring simultaneously at an upscale restaurant across town, where my family gathered to honor Victoria's upcoming marriage. Jennifer Walsh maintained her commitment to providing overnight support during the first evening following my surgery, staying in my guest room to monitor my condition and assist with medication management and mobility needs. Her presence offered both practical assistance and emotional comfort during a vulnerable period when family support would have been most meaningful and appropriate. The contrast between Jennifer's reliable presence and my family's absence during this critical recovery period highlighted the difference between relationships based on genuine care and those maintained through obligation and social expectation. Jennifer's willingness to sacrifice her Friday evening to provide medical support demonstrated commitment that exceeded anything my family had offered during previous challenges or difficulties. The Saturday morning of Victoria's wedding day began with my participation in the post-surgical care routine that would characterize my recovery period for the following weeks. The medical requirements included wound care, medication administration, and careful monitoring of healing progress that required attention and precision, but allowed for reflection on the events that had led to this moment of independence and self-reliance. Dr. Mitchell conducted a scheduled check-in phone call during the morning hours to assess my recovery progress and address any concerns that might have developed during the first 48 hours following surgery. Her professional assessment confirmed appropriate healing and pain management while providing encouragement about my recovery trajectory and prognosis for return to normal activities. The conversation with Dr. Mitchell also included discussion of my family situation and the emotional challenges associated with managing cancer treatment without traditional support systems. Her perspective as both medical professional and colleague provided valuable insight about the psychological aspects of recovery and the importance of maintaining focus on healing rather than family dysfunction during this critical period. The wedding ceremony itself occurred during the afternoon hours when I was resting at home and managing the fatigue that characterized the early recovery phase following major surgery. The elaborate celebration that my family had prioritized over my medical needs proceeded according to the detailed plans that had consumed their attention and energy for months, while I faced cancer diagnosis and treatment. Social media updates from wedding guests provided glimpses of the celebration that revealed the success of my family's planning efforts and their apparent satisfaction with the event that had justified abandoning their daughter during a medical emergency. The photographs showed my parents beaming with pride as they participated in ceremonies that represented the culmination of their hopes and dreams for their favored daughter. Victoria's wedding photographs captured moments of joy and celebration that demonstrated her complete happiness and satisfaction with the day that had been prioritized over my cancer surgery. The images showed no evidence of concern or awareness about my medical situation, reflecting the emotional compartmentalization that had characterized her response to my health crisis throughout the treatment process. My mother's appearance in the wedding photographs revealed the energy and attention that she was capable of investing in events that aligned with her priorities and preferences. Her radiant smile and active participation in wedding activities provided clear evidence that the emotional unavailability she had demonstrated during my medical crisis was a choice rather than a limitation of her capacity for engagement and support. My father's participation in wedding activities demonstrated similar patterns of selective availability and investment. The photographs showed him actively engaged in ceremonies and celebrations that reflected his commitment to ensuring Victoria's perfect day, while simultaneously revealing his absence during my medical emergency as a deliberate prioritization, rather than an unavoidable conflict. The wedding reception that evening continued the elaborate celebration with dining, dancing, and entertainment that represented the social recognition and family celebration that had been deemed more important than supporting their daughter through cancer treatment. The event proceeded exactly as planned despite my absence, confirming that my role in family dynamics had been accurately assessed as secondary and dispensable. The Sunday morning following Victoria's wedding brought the beginning of her honeymoon, departure, and the conclusion of the wedding festivities that had consumed my family's attention during my surgery and initial recovery period. The timing provided an opportunity to assess my emotional response to having successfully managed the most critical phase of my medical treatment, while my family celebrated Victoria's marriage. The absence of any communication from my family during the wedding weekend had initially been painful, but had evolved into a form of liberation from the emotional burden of managing their expectations and reactions during my recovery process. The freedom from family drama and competing priorities had allowed for complete focus on healing and self-care without the complications that their involvement might have introduced. The post-wedding period also marked the beginning of my family's return to normal routines and their potential recognition that my cancer surgery had occurred during their celebration weekend. The question of whether they would acknowledge this timing conflict or attempt to reconnect following the conclusion of wedding activities would provide additional insight into their priorities and values. Monday morning brought the first communication from my family since my surgery, delivered through a brief text message from my mother inquiring about my recovery progress and expressing hope that everything had proceeded smoothly during the weekend. The casual tone and delayed timing of this communication reflected the minimal importance that my medical situation held in her priorities compared to the wedding celebration that had consumed her attention. The text message contained no acknowledgement of the timing conflict between my surgery and Victoria's wedding, no recognition of the emotional impact of their absence during my medical crisis, and no expression of regret about their failure to provide support during one of the most challenging periods of my life. The communication appeared to represent an attempt to resume normal family interactions without addressing the fundamental abandonment that had occurred. My response to this initial post-wedding communication required careful consideration of how to establish boundaries and manage expectations going forward. The experience of successful independent medical management had provided confidence in my ability to navigate challenges without family support, while simultaneously revealing the conditional and unreliable nature of their concern and involvement. The decision about how to respond to my family's post-wedding outreach would establish precedents for future interactions and communication patterns. The cancer treatment experience had demonstrated that I could manage significant life challenges without their support, raising questions about the value and necessity of maintaining relationships that consistently prioritized others' needs over my own well-being. Jennifer continued her support during this transition period, helping to process the emotional complexity of family reconnection attempts while maintaining focus on recovery priorities and self-care requirements. Her objective perspective provided valuable guidance about relationship management and boundary establishment during a vulnerable period when family manipulation might be particularly effective. The cancer support group meetings during this period provided additional perspective on family dynamics during medical treatment and the common patterns of dysfunction that emerged when serious illness created demands for genuine sacrifice and support from family members. Other group members shared similar experiences of family abandonment during medical crises and the personal growth that often resulted from developing independence and alternative support systems. These group discussions reinforced that my family's behavior was unfortunately common rather than unique, and that the personal strength and resilience developed through independent medical management often exceeded anything that traditional family support might have provided. The forced independence had created opportunities for self-discovery and relationship building that enhanced my life in ways that extended beyond my medical treatment and recovery. The recovery period also provided time for reflection on the broader implications of my family's choices and the fundamental changes in my understanding of relationships, loyalty, and self-worth that had emerged through this experience. The medical crisis had stripped away illusions about family dynamics while revealing authentic sources of strength and support that had been overshadowed by my focus on gaining family acceptance. The successful completion of surgery and initial recovery without family support had demonstrated capabilities and resilience that I had not previously recognized or developed. The experience provided confidence in my ability to navigate future challenges independently, while maintaining relationships that were based on mutual respect and genuine care, rather than obligation and accommodation. The approaching decisions about chemotherapy treatment, radiation therapy, and long-term recovery planning would provide additional opportunities to practice independence and self-advocacy while building on the foundation of authentic relationships that had proven reliable during the most critical phases of my medical treatment. The cancer diagnosis that had initially seemed to threaten everything I valued had become the catalyst for discovering what truly mattered in life and relationships. The phone call that would fundamentally alter my understanding of family audacity and emotional manipulation arrived on a Tuesday evening in November, exactly 5 months after my cancer surgery and Victoria's wedding celebration. I was seated in my living room reviewing medical documentation related to my chemotherapy treatment schedule when my mother's contact information appeared on my phone screen, marking the first attempt at direct communication since her brief text message inquiry during my immediate post-surgical recovery period. The intervening months had been characterized by minimal family contact, and my continued focus on cancer treatment, professional responsibilities, and the cultivation of authentic relationships that prioritized my well-being and recovery progress. The kawi. Absence of family involvement during my chemotherapy sessions had initially created emotional challenges, but had ultimately reinforced the reliability and depth of the alternative support systems that had sustained me through the most difficult phases of my medical treatment. My chemotherapy treatment protocol had proceeded according to the medical timeline established by my oncology team, with sessions occurring every 3 weeks throughout the summer and early autumn months. The treatment process had been demanding, both physically and emotionally, requiring significant lifestyle adjustments and ongoing medical monitoring that would have traditionally involved extensive family support and coordination. Jennifer Walsh and my nursing colleagues had continued to provide the practical assistance and emotional encouragement that enabled successful completion of each chemotherapy cycle, while maintaining my professional responsibilities and personal well-being. Their consistent availability and genuine concern had demonstrated what authentic support looked like when compared to the conditional and unreliable attention that had characterized my family relationships throughout my lifetime. Dr. Mitchell had coordinated my work schedule to accommodate treatment requirements while ensuring that my professional responsibilities were managed appropriately during periods when chemotherapy side effects limited my energy and concentration capabilities. The accommodation and understanding provided by my medical colleagues had created a supportive environment that facilitated both successful treatment completion and continued career development. The cancer support group meetings had continued to provide valuable perspective and encouragement throughout the chemotherapy treatment period, with other participants sharing experiences and coping strategies that enhanced my ability to manage treatment challenges while maintaining focus on recovery goals and long-term health outcomes. My physical recovery and treatment response had exceeded medical expectations, with regular monitoring appointments revealing positive progress indicators and successful tumor response to the chemotherapy protocol. The medical team had expressed satisfaction with my treatment outcomes and optimism about long-term prognosis based on the comprehensive treatment approach and my proactive participation in all aspects of care. The emotional and psychological recovery process had been equally significant, with the months of independent medical management providing opportunities for personal growth and self-discovery that extended far beyond my cancer diagnosis and treatment. The necessity of self-advocacy and autonomous decision-making had revealed capabilities and strengths that had been dormant during decades of accommodation and secondary status within family dynamics. The absence of family drama and competing priorities during my treatment period had allowed for complete focus on healing and recovery, without the emotional complications that their involvement might have introduced. The freedom from family expectations and obligations had provided space for authentic self-reflection and the development of life priorities based on personal values rather than external approval and accommodation. When my mother's phone call interrupted this peaceful evening of medical record review, I answered with curiosity about what might have prompted this unexpected communication after months of minimal contact during my cancer treatment. Her voice carried the casual tone that had characterized our interactions throughout my lifetime, suggesting that she viewed this conversation as routine family communication rather than reconnection following a period of medical crisis abandonment. The initial pleasantries of the conversation focused on superficial updates about family activities and general inquiries about my health status that demonstrated polite interest rather than genuine concern or understanding about the significance of my cancer treatment experience. My mother's tone suggested that she viewed my medical situation as concluded and no longer requiring special consideration or family attention. The conversation progressed through routine family news and updates about Victoria's married life, honeymoon experiences, and adjustment to her new living arrangements with David. The detailed description of Victoria's happiness and successful transition to married life provided clear evidence that my parents had maintained close contact and ongoing involvement in her life during the same period when they had been absent from my medical treatment process. My mother's communication style during this conversation reflected the same patterns of selective attention and conditional engagement that had characterized our relationship throughout my lifetime. Her enthusiasm for discussing Victoria's experiences contrasted sharply with her perfunctory inquiries about my recovery progress and current health status. The pivotal moment in the conversation occurred when my mother transitioned from general family updates to the specific purpose that had motivated her decision to call after months of minimal communication. Her tone shifted to the particular combination of expectation and entitlement that had historically preceded requests for my accommodation and flexibility in service of family priorities. The requests that emerged from this conversation exceeded anything I had previously experienced in terms of audacity and complete disconnect from reality regarding our family dynamics and recent history. My mother explained that Victoria and David were planning a vow renewal ceremony to celebrate their 6-month wedding anniversary and wanted to create an even more elaborate celebration than their original wedding had provided. The vow renewal ceremony was being planned as a destination event that would require significant financial investment and coordination from family members who would be expected to participate in multiple days of celebration activities. My mother described the event with the same enthusiasm and detailed planning approach that had characterized Victoria's original wedding preparation. The specific request that followed this explanation demonstrated a level of entitlement and emotional tone deafness that shocked me despite my lifetime of experience with family dysfunction and prioritization patterns. My mother asked whether I would be willing to serve as Victoria's maid of honor for the vow renewal ceremony, explaining, that Victoria had decided that having her sister in this prominent role would enhance the significance and family unity of the celebration. The timing and context of this request revealed assumptions about my availability and willingness to participate in family celebrations that completely ignored the recent history of their abandonment during my cancer treatment. The casual manner in which my mother presented this request suggested that she expected my immediate agreement and enthusiasm for supporting Victoria's additional celebration plans. My mother's explanation for Victoria's decision to include me as maid of honor focused on the visual impact and family representation that my participation would provide, rather than any recognition of our relationship quality or acknowledgement of the treatment I had received during my medical crisis. The request was framed as an honor that I should appreciate, rather than an obligation that followed months of family neglect and abandonment. The conversation continued with detailed descriptions of the planned celebration activities, estimated costs for participation, and timeline requirements that would necessitate significant time commitments and financial investment from family members who agreed to participate in the vow renewal festivities. The planning scope exceeded even Victoria's original wedding in terms of complexity and expense. My mother's presentation of these details assumed my automatic participation and began assigning responsibilities and expectations for my role as maid of honor without waiting for my response to the initial request. The presumptive tone reflected her expectation that I would resume my traditional family role of accommodation and support, regardless of recent experiences and relationship changes. The financial implications of serving as maid of honor for Victoria's vow renewal ceremony included expenses for travel to the destination location, accommodation costs for multiple nights, special attire requirements, and contributions to various celebration activities that would total several $1,000s in additional costs during a period when my cancer treatment had already created significant medical expenses. The time requirements would necessitate extended absence from work during a period when I was still managing ongoing medical appointments and recovery activities related to my cancer treatment. The assumption that my professional and personal obligations could be easily adjusted to accommodate Victoria's celebration timeline demonstrated the same dismissive attitude toward my priorities that had characterized my family's response to my medical crisis. My mother's tone throughout this conversation suggested that she viewed my potential participation as inevitable rather than optional, reflecting her assumption that our family relationships had returned to normal patterns despite the recent abandonment during my cancer treatment. The lack of acknowledgement about their behavior during my medical crisis indicated that she expected me to resume previous relationship dynamics without addressing the fundamental breach of trust and support that had occurred. The conversation also revealed that my family had been actively planning this celebration for several months while maintaining minimal contact with me during my ongoing cancer treatment, suggesting that their emotional energy and attention had been directed toward party planning rather than family member support during a medical emergency. The expectation that I would enthusiastically embrace the opportunity to serve as maid of honor demonstrated a complete disconnect from reality regarding the current state of our relationships and my perspective on family loyalty and obligation following their behavior during my cancer diagnosis and treatment. The request itself represented the culmination of decades of taking my accommodation and support for granted while providing minimal consideration or reciprocal care in return. The timing following my independent navigation of cancer treatment, without their support, created a particularly stark illustration of their continued expectation that I would prioritize their celebration needs over my own well-being and self-respect. As my mother concluded her detailed presentation of the vow renewal plans and my expected participation as maid of honor, I recognized that this moment represented a critical decision point about the future direction of my family relationships and my commitment to the personal growth and boundary establishment that had emerged through my cancer treatment experience. The silence that followed my mother's request stretched across the phone line for what felt like an eternity, though it lasted only 30 seconds in actual time. During those crucial moments, I experienced a clarity of thought and purpose that had been building throughout the months of cancer treatment and independent recovery. The audacious nature of her request had crystallized everything I had learned about family dysfunction, personal boundaries, and the difference between genuine relationships and exploitative arrangements disguised as family loyalty. The response that emerged from this moment of clarity represented the culmination of months of personal growth and self-discovery that had been catalyzed by my cancer diagnosis and my family's abandonment during my greatest time of need. The words that came from my mouth surprised even me with their directness and emotional honesty, reflecting a fundamental shift in how I viewed my role within family dynamics and my willingness to accommodate unreasonable expectations. "Mom," I began, my voice steady despite the magnitude of what I was about to communicate. "I need you to understand something very clearly. When I was diagnosed with cancer, when I needed my family most, you chose Victoria's wedding over my surgery. You abandoned me during the most frightening experience of my life because party planning was more important than your daughter's health and survival." The words continued to flow with increasing strength and conviction as I articulated thoughts and feelings that had been developing throughout my treatment process, but had never been expressed directly to the family members who had caused such profound hurt and disappointment. The cancer experience had provided both the motivation and the courage to speak truth that had been suppressed for decades in the interest of maintaining family peace and avoiding confrontation. "You didn't call before my surgery to offer support or encouragement. You didn't visit me in the hospital to check on my recovery. You didn't offer assistance during my chemotherapy treatments when I was sick and exhausted. You were completely absent from the most challenging period of my life because you were too busy celebrating Victoria's perfect day." My mother's response revealed the depth of her disconnection from reality regarding the impact of her choices and the current state of our relationship. Her tone carried surprise and defensiveness rather than recognition or remorse, suggesting that she genuinely believed that time had erased the significance of her abandonment and that normal family interactions could resume without acknowledgement or accountability. "Rebecca, that's not fair," she protested with evident frustration. "The wedding had been planned for months. We couldn't just abandon all those arrangements because of your medical timing. You know how important Victoria's Day was to our family. Besides, you managed fine on your own, so obviously you didn't really need our help anyway." This response demonstrated the fundamental lack of understanding that had characterized my family's approach to relationships throughout my lifetime. The suggestion that successful independent management of a medical crisis indicated absence of need for family support revealed a profound misunderstanding of emotional connection and the role of family relationships during challenging circumstances. "The fact that I survived and recovered without your support doesn't justify your decision to abandon me," I continued, feeling increasingly empowered by my ability to articulate these truths clearly and directly. Cancer patients shouldn't have to prove their worthiness for family support by demonstrating inability to manage independently. The point of family relationships is supposed to be mutual care and support during difficult times, not conditional assistance based on convenience and competing priorities. The conversation continued with my mother offering various justifications and explanations for their behavior that revealed a pattern of rationalization and denial that prevented acknowledgement of the fundamental breach of family loyalty that had occurred. Her responses focused on minimizing the significance of my medical situation, while emphasizing the importance of Victoria's celebration, maintaining the same prioritization that had created the original abandonment. "Victoria's wedding was a once-in-a-lifetime event," my mother insisted, her voice taking on the defensive tone that had characterized her communications throughout my childhood when her preferential treatment of Victoria was questioned or challenged. "Your surgery was just a medical procedure that happened to fall on an inconvenient weekend. We had family obligations and financial commitments that couldn't be changed." The characterization of cancer surgery as merely inconvenient timing, while describing a social celebration as a once-in-a-lifetime event that justified abandoning a family member during a medical emergency, revealed values and priorities that I finally recognized as fundamentally incompatible with my understanding of family relationships and human decency. Mom, what you just said perfectly illustrates why I cannot and will not serve as Victoria's maid of honor, I responded with increasing conviction and clarity. You just described my cancer surgery as an inconvenience while calling Victoria's party a sacred obligation. You've revealed exactly how you view your daughters and what our relative worth is in your estimation. The conversation reached its crucial turning point as I articulated the decision that had been forming throughout months of independent medical management and relationship evaluation. The clarity that had emerged through my cancer treatment experience provided the foundation for establishing boundaries and expectations that would govern all future family interactions. I will not participate in Victoria's vow renewal ceremony. I will not serve as her maid of honor. I will not pretend that we have the kind of family relationships that would make such participation appropriate or meaningful. The time for pretending that we're a normal, loving family is over. My mother's response escalated to include emotional manipulation tactics that had been effective throughout my childhood, but no longer carried the same power to influence my decisions and behavior. She expressed disappointment in my attitude, suggested that I was being overly dramatic about past events, and implied that my refusal to participate would damage family relationships and create lasting divisions. You're being incredibly selfish and vindictive, she declared with the authoritative tone that had historically ended discussions when my compliance was required. This is Victoria's special time, and you're trying to ruin it because you're still upset about ancient history. Family means forgiveness and moving forward, not holding grudges about things that can't be changed. The attempt to reframe my boundary setting as vindictiveness and selfishness represented a classic manipulation strategy that had been employed throughout my lifetime to ensure my accommodation and compliance with family expectations. The characterization of their abandonment during my cancer treatment as ancient history revealed a fundamental disconnect from the emotional impact and ongoing significance of their choices. This isn't about vindictiveness or grudges, I replied, with calm certainty. This is about recognizing patterns of behavior and making decisions based on demonstrated values and priorities. Your actions during my cancer treatment revealed how you actually view our relationship and my importance in your life. I'm simply responding accordingly. The conversation continued with my mother attempting various approaches to securing my participation, including appeals to family unity, suggestions that Victoria would be devastated by my refusal, and implications that my decision would reflect poorly on my character and family loyalty. Each attempt at manipulation only reinforced my conviction that establishing clear boundaries was essential for protecting my emotional well-being and self-respect. Victoria will understand my decision when it's explained to her honestly, I stated. If she's truly devastated by my refusal to participate, perhaps she should consider how her complete indifference to my cancer diagnosis and treatment might have affected our relationship. Actions have consequences, and those consequences include changes in how relationships function going forward. The financial manipulation began when my mother suggested that my medical expenses might have created financial stress that was influencing my decision-making and offered to help with costs associated with participating in the vow renewal ceremony. This approach demonstrated her continued misunderstanding of my motivations, while revealing her belief that financial assistance could purchase my compliance and participation. This isn't about money, I clarified firmly. This is about respect, consideration, and authentic family relationships based on mutual care rather than one-sided accommodation. The fact that you think financial assistance could resolve this situation shows how completely you misunderstand what's actually at stake in our relationship. The conversation reached its conclusion when my mother's frustration peaked, and she resorted to threats about family consequences and social embarrassment that would result from my non-participation. The threats revealed the extent to which family events were viewed as performances for external validation rather than authentic celebrations of relationships and milestones. If you don't participate, people will ask questions about why Victoria's sister isn't involved in her celebration, my mother warned. How do you think that will reflect on our family? What are we supposed to tell people when they notice your absence? The concern about external appearances and social judgment provided final confirmation that my family's priorities centered on maintaining facades rather than addressing genuine relationship issues or acknowledging the impact of their behavior on family members. The suggestion that I should participate to protect their social reputation despite their abandonment during my medical crisis represented the ultimate expression of their self-centered approach to family relationships. You can tell people the truth, I responded with finality. You can explain that when I was diagnosed with cancer, you chose to attend Victoria's wedding instead of supporting me through surgery. You can tell them that I'm no longer willing to pretend that we have close family relationships when your actions demonstrate otherwise. The phone call concluded with my mother expressing disappointment and frustration, while making clear that she viewed my decision as unreasonable and harmful to family unity. Her inability to acknowledge the legitimacy of my perspective, or the impact of their previous choices, confirmed that the relationship patterns that had created this situation were unlikely to change through conversation or explanation. The immediate aftermath of this conversation brought a mixture of emotions including relief, empowerment, and some residual sadness about the definitive nature of the boundary I had established. The clarity and conviction I had experienced during the conversation confirmed that my decision aligned with the personal growth and self-respect that had developed throughout my cancer treatment experience. The days following this conversation provided opportunities to process the significance of having finally articulated truths that had been suppressed throughout my lifetime of accommodation and secondary status within family dynamics. The ability to speak honestly about the impact of their choices and to establish clear boundaries represented a fundamental shift in how I approached relationships and personal advocacy. Jennifer Walsh and Dr. Mitchell both provided support and perspective during this transition period, helping me recognize the courage and growth that had been required to establish these boundaries, while maintaining focus on continued recovery and professional development. Their validation reinforced my confidence in the decision and provided encouragement for maintaining these new relationship standards going forward. The cancer support group discussions during this period focused on family relationship changes that often accompanied serious medical experiences, and the importance of surrounding oneself with people who demonstrated genuine care and reliability during challenging circumstances. Other group members shared similar experiences of family dysfunction during medical crises and the empowerment that came from establishing appropriate boundaries and expectations. The conversation with my mother had marked a definitive transition point in my understanding of family relationships and my willingness to accept treatment that failed to meet basic standards of respect and consideration. The cancer experience had provided both the motivation and the courage to establish boundaries that would protect my emotional well-being, while maintaining integrity about my own worth and the standards I would accept in relationships going forward. The immediate aftermath of my conversation with my mother unleashed a coordinated family response that revealed the depth of dysfunction and emotional manipulation that had characterized our relationships for decades. Within 24 hours of my refusal to serve as Victoria's Maid of Honor, I received a series of phone calls, text messages, and voicemails from various family members who had been mobilized to convince me to reconsider my decision and resume my traditional role of accommodation and compliance. The first contact came from my father, whose phone call arrived at 7 o'clock the following morning while I was preparing for my weekly oncology follow-up appointment. His approach differed from my mother's emotional manipulation, instead, focusing on logical arguments and practical considerations that he believed would persuade me to change my position and participate in Victoria's vow renewal ceremony despite our recent history. Robert Chen's communication style had always emphasized rationality and problem-solving over emotional processing, and his response to this family crisis followed those established patterns. He began the conversation by acknowledging that the timing of my surgery and Victoria's wedding had created unfortunate circumstances, but he framed the situation as a scheduling conflict rather than a deliberate choice that revealed family priorities and values. Rebecca, I understand you're upset about how things worked out with your surgery and the wedding, he said with the measured tone he employed when addressing workplace conflicts or business disagreements. But we need to think about this situation practically and consider what's best for the family going forward. Holding on to resentment isn't going to help anyone. My father's characterization of my boundary setting as resentment demonstrated the same fundamental misunderstanding that had driven my mother's response to my refusal. The family's inability to recognize the legitimacy of my perspective or acknowledge the significance of their abandonment during my medical crisis indicated that genuine accountability or relationship repair was unlikely to emerge through continued discussion. Dad, this isn't about resentment, I responded with the clarity and conviction that had developed throughout my cancer treatment experience. This is about recognizing patterns of behavior and making decisions based on demonstrated values and priorities. When I needed family support most, you chose Victoria's party over my medical emergency. That choice revealed how you actually view our relationship and my importance in your life. The conversation continued with my father attempting to minimize the significance of their absence during my cancer treatment by emphasizing the successful outcomes that had been achieved without their involvement. His argument suggested that their support had been unnecessary since I had managed the medical crisis independently, revealing a profound misunderstanding of the emotional and psychological aspects of family relationships during challenging circumstances. You handled everything perfectly well on your own, he stated with apparent satisfaction. You had good medical care, your colleagues provided assistance, and you recovered successfully. So obviously our presence wasn't actually needed for a positive outcome. The wedding, on the other hand, required family participation and couldn't proceed without our involvement. This response encapsulated the transactional approach to relationships that had characterized my family's behavior throughout my lifetime. The suggestion that family support was unnecessary because alternative assistance had been available revealed their view of relationships as optional conveniences rather than fundamental sources of emotional connection and mutual care during difficult periods. The phone call from Victoria herself arrived that evening, marking the first direct communication between us since my cancer diagnosis 8 months earlier. Her voice carried a mixture of hurt and indignation that suggested she genuinely believed herself to be the victim in this situation, despite her complete absence during my medical crisis and treatment process. Victoria's approach to the conversation reflected the same self-centered perspective that had characterized her response to my cancer diagnosis and treatment throughout the previous months. She began by expressing disappointment about my refusal to participate in her vow renewal ceremony while showing no recognition or acknowledgement of her behavior during my medical emergency. I can't believe you're trying to ruin my special day because you're still upset about your surgery timing, she said with evident frustration. This is supposed to be a celebration of David's and my love and commitment, and you're making it about your medical drama instead of being happy for your sister's happiness. The characterization of my cancer treatment as medical drama and the suggestion that my boundary setting was motivated by jealousy or vindictiveness demonstrated the extent of Victoria's emotional immaturity and self-absorption. Her inability to recognize the connection between her behavior during my cancer crisis and my current unwillingness to participate in her celebration revealed a fundamental lack of insight about cause and effect in relationships. Victoria, this isn't about ruining your celebration, I replied with patient firmness. This is about acknowledging that relationships require mutual care and support. When I was diagnosed with cancer, you showed no concern for my well-being or interest in my treatment. You never called, never visited, never offered assistance during the most challenging period of my life. Your complete indifference to my medical crisis has consequences for our relationship going forward. Victoria's response revealed her expectation that family relationships should operate according to her convenience and priorities, with others providing support and participation when beneficial to her while accepting neglect and indifference, when her attention was focused elsewhere. Her inability to connect her behavior during my cancer treatment with my current decision demonstrated the same emotional disconnection that had characterized her response throughout my medical crisis. "That's completely unfair," she protested with increasing agitation. "I was busy with wedding planning and starting my married life. I had important things to focus on. Besides, you had plenty of other people helping you, so you didn't need me. Anyway, but this is my vow renewal, and I need my sister there to make it special and meaningful." The contrast between her characterization of wedding planning as important things while dismissing my cancer treatment as something that required minimal family attention provided clear evidence of the value system that governed her decision-making and relationship priorities. Her expectation that I should provide support for her celebration despite her absence during my medical emergency revealed the one-sided nature of her understanding of family obligations. The extended family members who had been recruited to influence my decision provided additional insight into the family dynamics and communication patterns that had enabled decades of dysfunction and preferential treatment. My Aunt Linda, my mother's sister, called to express concern about family unity and suggest that my refusal to participate would create lasting divisions that could affect future family relationships and gatherings. "Rebecca, I know you've been through a difficult time with your health situation," Linda said with apparent sympathy, "but family means forgiveness and moving forward together. Victoria loves you and wants you to be part of her special celebration. Sometimes we have to put aside our hurt feelings for the good of the family." The advice to prioritize family unity over personal boundaries and self-respect reflected the enabling attitudes that had allowed problematic behavior patterns to persist throughout my lifetime. The suggestion that I should suppress legitimate concerns about how I had been treated in order to maintain family harmony demonstrated the same prioritization that had created the original abandonment during my medical crisis. "Aunt Linda, I appreciate your concern about family relationships," I responded respectfully but firmly. "But genuine family unity requires mutual respect and consideration. The current family dynamics are based on my constant accommodation, while others pursue their priorities without regard for my needs or well-being. That pattern is unhealthy for everyone involved." The conversation with my aunt revealed that my family had presented a distorted version of events to extended relatives, minimizing their abandonment during my cancer treatment, while emphasizing my current refusal to participate in Victoria's celebration. The selective information sharing suggested deliberate manipulation of family perceptions to generate pressure for my compliance and participation. My cousin Maria, who had maintained closer relationships with my immediate family members throughout our adult lives, provided additional perspective on the family's response to my boundary setting and their strategies for securing my participation in Victoria's vow renewal ceremony. Her phone call included information about discussions and planning that had occurred among family members following my refusal. "They're really upset about your decision," Maria confided during our conversation. "Your mom and Victoria have been calling everyone in the family to talk about how unreasonable you're being. They're planning to have your dad and some of the uncles call you to convince you to change your mind. They think if enough people pressure you, you'll give in like you usually do." This information confirmed that my family viewed my boundary setting as a temporary rebellion that could be overcome through sufficient pressure and manipulation rather than a genuine change in my willingness to accept their treatment and prioritization patterns. Their strategy of mobilizing extended family members to influence my decision demonstrated the same controlling approaches that had characterized their behavior throughout my lifetime. The revelation that my family was actively working to undermine my decision and manipulate my compliance provided additional confirmation that genuine relationship repair or acknowledgement was unlikely to emerge from continued engagement. Their focus on securing my participation, rather than addressing the underlying issues that had created the situation, indicated that superficial resolution was more important to them than authentic relationship improvement. The workplace support I continued to receive during this period of family pressure provided valuable contrast to the manipulation and coercion that characterized my family's approach to conflict resolution. Dr. Mitchell and my nursing colleagues offered perspective and encouragement that reinforced my confidence in the boundaries I had established while maintaining focus on my continued recovery and professional development. Family pressure tactics often intensify when someone starts establishing healthy boundaries, Dr. Mitchell explained during one of our conversations about the situation. People who have benefited from dysfunctional relationship patterns will resist changes that require them to modify their behavior or expectations. Your consistency in maintaining your boundaries will ultimately determine whether genuine relationship improvement is possible. The cancer support group discussions during this period focused on family relationship changes that commonly occurred following serious medical experiences and the importance of maintaining boundaries despite pressure and manipulation from family members who preferred previous dysfunction to accountability and change. Other group members shared similar experiences of family resistance to boundary setting and the empowerment that came from maintaining standards despite external pressure. These conversations reinforced that my experience was part of a common pattern that occurred when serious medical challenges revealed family dysfunction and created opportunities for relationship evaluation and boundary establishment. The validation from others who had navigated similar circumstances provided encouragement for maintaining my decision, despite the coordinated family pressure campaign. The emotional toll of managing constant family pressure while continuing my cancer treatment and recovery process required careful attention to self-care and stress management strategies that protected my physical and emotional well-being during this challenging period. The contrast between the energy required to manage family manipulation and the peace that came from authentic relationships highlighted the importance of maintaining boundaries that preserved my health and recovery priorities. The financial pressure tactics began when my mother offered to pay all expenses associated with my participation in Victoria's vow renewal ceremony, including travel costs, accommodation, special attire, and any other requirements that might create barriers to my involvement. The offer demonstrated her belief that financial concerns were motivating my refusal, and that monetary assistance could secure my compliance and participation. Money isn't the issue, I explained during the phone call where this offer was presented. This is about respect, consideration, and authentic family relationships based on mutual care rather than one-sided accommodation. The fact that you think financial assistance could resolve this situation shows how completely you misunderstand what's actually at stake in our relationship. The family's continued inability to recognize the emotional and relational aspects of my decision, despite clear explanations, indicated that their understanding of family relationships remained focused on transactions and obligations rather than genuine connection and mutual support. Their persistent attempts to find external solutions to what was fundamentally an issue of values and priorities revealed the depth of their disconnection from authentic relationship principles. The family pressure campaign reached unprecedented levels during the third week following my refusal to participate in Victoria's vow renewal ceremony. The coordinated attempts at manipulation evolved from simple phone calls and guilt tactics to more sophisticated strategies that revealed the extent of their investment in maintaining control over my decisions and behavior patterns that had characterized our relationships for decades. My mother's approach during this escalation period demonstrated increasing desperation and a willingness to employ manipulation tactics that exceeded anything I had previously experienced in our family dynamics. Her communication frequency increased to multiple daily attempts through various channels, including phone calls, text messages, emails, and even handwritten letters delivered to my apartment building that contained emotional appeals and thinly veiled threats about family consequences. The content of these communications revealed my mother's growing frustration with her inability to secure my compliance through traditional manipulation methods that had historically proven effective. In securing my accommodation and participation in family priorities, her messages alternated between expressions of disappointment and hurt feelings, attempts at guilt manipulation, and increasingly aggressive demands for explanation and justification of my decision. One particularly revealing voicemail message captured the essence of her perspective on our relationship and her expectations for my role within family dynamics. Patricia Chen's voice carried a combination of bewilderment and indignation as she expressed her inability to understand why her previous reliable source of accommodation and flexibility was no longer responding to familiar pressure tactics and emotional manipulation strategies. "Rebecca, I don't understand what's happened to you since your surgery," she said with evident frustration and confusion. "You used to be such a considerate daughter who cared about family unity and supporting your sister's happiness. Now you're being selfish and vindictive over something that happened months ago. Victoria is heartbroken that her only sister won't be part of her special celebration because you're holding grudges about ancient history." The characterization of my cancer treatment and their abandonment as ancient history demonstrated the fundamental disconnect between their perception of events and the ongoing impact of their choices on my understanding of family relationships and personal worth. The suggestion that consideration required acceptance of mistreatment while boundary setting represented selfishness revealed value systems that prioritized superficial harmony over authentic respect and mutual care. The escalation included recruitment of family friends and community members who had relationships with multiple family members and could potentially influence my decision through social pressure and concern about public perception of family discord. These individuals were provided with selective information about the situation that portrayed my refusal as unreasonable resistance to supporting Victoria's happiness rather than legitimate response to family abandonment during medical crisis. Mrs. Helen Thompson, a longtime family friend who had known our family since Victoria and I were children, contacted me with concerns about family relationships and suggestions that reconciliation was necessary for maintaining community standing and social reputation. Her phone call revealed the extent to which my family had misrepresented the situation to generate external pressure for my compliance. "Your mother is very upset about this situation with Victoria's celebration," Mrs. Thompson said with apparent concern for family harmony. "She's told me that you're refusing to participate because of some scheduling conflicts that occurred during your medical treatment. I know families can have disagreements, but surely this is something that can be resolved through forgiveness and understanding." The description of my family's abandonment during cancer treatment as scheduling conflicts demonstrated the deliberate minimization and misrepresentation that characterized their communication with external parties who might influence my decision. The selective information sharing served to generate support for their position, while concealing the actual circumstances that had created the current relationship breakdown. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.